What's up, everybody, and welcome to the Movement is Medicine show. And we have an extra special guest today, Dr. Rebecca Hoppins. Welcome to the show.
Thanks, Barry. Always nice to see you.
Yeah, it's been a bit since we had you on the show.
Yeah, it has.
No, I also have Dr. Lee here, who's incredible as well.
Well, not as incredible as Dr. Hoppins, but you know.
Yeah, I mean, you try, though.
You're
really good.
You got to emulate somebody that's above you in order to get there, right?
That's right.
I call him the wizard all the time.
I love it. And we have the founder, our leader.
Yes,
Dr.
your leader,
Annie
Dr. Annie.
Armstrong.
Fearless.
Yes.
The new glasses are popping off today, too.
I know,
I
they're
love
popping.
those. I
They're
love those
popping.
glasses, and that's a nice sweater. If you guys could only see, the sweater is it's supreme. Today's show, interesting show, cool topic, timely topic. We're gonna crack the code on ear congestion today. It's something that we're seeing a lot of it. Becky, you tell us what's going on.
Yeah, well, one of the ways we come up with the name of cracking the code of ear congestion is that's what people hear in their ears, is cracking and popping. And finding the cause of that can be elusive because everybody thinks it's allergies.
and or sinusitis, you know, and so Dr. Lee and I were chatting about this because we see so much of this in the clinic, especially, I mean, all the time, allergy time of the year too, but really this time of the year. And really, I had a patient case just recently that, you know, this show is dedicated to, but I can't say his name, but I'll tell him to listen to it and he'll know exactly who I'm talking about. But anyway, you know, someone who's usually been through ear, eye, nose, throat. They've had some diagnostics. They've taken some medication. They may have taken antibiotics.
Antihistamines,
Antihistamines, yes. And he's done all those things. Mm-hmm. And then, you know, coming into the chiropractor to get their neck cleared. And Dr. Lee will talk a bit about lymphatic involvement as well. Really super valuable for ear congestion, certainly. But I have hiked with Dr. Hoppins enough to know the insides and outs of ear congestion through many hours on the trail together. So I just immediately thought we need to bring her in and talk about this. It's just such an important topic for people to have an awareness of the other elements of it.
Yeah. So the symptoms are ear fullness. There can be what's the word?
Loss of hearing.
Yeah, loss of hearing or muffled hearing. And there may or may not be sinus congestion associated with it or a sense of postnasal drip. And a lot of people aren't even aware that they're clearing their throat all the time, et cetera. So the structures that are involved are the middle ear. So when we talk about an ear infection, this is the area that's behind the eardrum. And there's a tube from there down to the back of the throat called the eustachian tube. And that's where the dysfunction is occurring. So it's a very small tube and it can get very easily blocked from either mucus or inflammation. And inflammation can come from a number of things. And so that's where we kind of get into the weeds of this, is how do you undo that, keep it open, relieve symptoms. So with allergies being the most common problem, allergens, whether they're internal, like indoors or outdoors, it's something that the immune system will react to, and we get these histamine responses, and histamine will cause vasodilation, and that causes swelling in these tissues. So that happens from the sinuses down through the nose, throat, and that passes by those eustachian tubes, so they close up. So antihistamines should work. And if they don't, we'll often give steroids to just make the areas thinner, less inflamed. But the problem is that we're then more exposed, more susceptible to infections at that point. So we don't like using steroids. Yes, they can be life-saving, et cetera, in many situations, but they don't take care of the underlying problem. So antibiotics, of course, will come into play when all the airways are closed because you then grow your own bugs that are there. So what I do is look at, okay, if the antihistamines aren't working and you've done all of them, it's not an allergy. What I typically find is it's some sort of reflux response. So many people feel heartburn, and just as many people don't feel the fact that they have their stomach contents coming up into their throat and into their head. And that's where I usually will get that stuff cleared out, whether we're doing food sensitivity stuff, changing the diet, digestive support, and then using various nutrients and other methods to clear that stuff. So
this is connected oftentimes in your experience, to kind of gut, stomach
Oh, yeah.
Absolutely.
Interesting. I thought we were going to maybe go down the mold pathway or something
Ooh,
like that. And I
yeah.
was like, well, maybe this is mold
Yeah.
toxicity.
I had
but-
this issue when I was younger, actually. Like when I was in like second, third grade, I had really bad GERD and I had really bad ear infections, like preceding that growing up. So this is all hitting home for me as well.
GERD is gastroesophageal reflux disease or
Yeah.
heartburn.
Exactly.
GERD. Yeah.
Yeah, I should probably tell people what GERD is.
Yeah. What happened?
Oh, I was just honestly, it was just a kid that loved sugar, eating a lot of sugar. As soon as I stopped cutting that out a little bit, I started having less acid reflux types of events. That's what we called it. I was actually on Prilosec for a little bit, which actually made things worse because it was more so blocking the calcium channels, where honestly the best thing for me was probably apple cider vinegar. And just making sure that I wasn't eating things that were irritating the stomach too much.
Yeah. Apple cider vinegar is a digestive enhancer.
Right.
As
Same
opposed to-
pH as stomach acid.
Yeah. And Prilosec is the opposite of that. Suppresses digestion.
Yeah.
So if the stomach is too full of something that it's not digesting well, it's going to send it back.
Right.
So where's it going to go? That lower esophageal sphincter is going to open. The gates are going to open and it'll get sent back up. So some people will feel that during the day, but gravity keeps it down. But when you lay down at night, if there's any relaxation of that sphincter, it's going to roll right up the throat, and that rolls right over the eustachian tubes. For people who have asthma, they will breathe in that acid, whether it's even suppressed by Prilosec or other proton pump inhibitors. It's going to irritate the lungs of somebody who has asthma. So I always will treat reflux. And it's the reflux, not the acid. We have to get the reflux under control if we can. And that's number one.
Well, it doesn't, like the Prilosec will also cause the dysfunction of your body making more acid than it needs to, correct? Because it's going to try to compensate for
Absolutely.
that lack of digestion. It's going to try to keep digesting things and adding more and more acid, which causes more and more reflux.
Yeah, that's when we start jumping through all the different medications.
Right.
I was going to say that starts the medication train oftentimes then. And what I think when you have somebody who's had this issue, they probably have gone through many, many, many different medications to try and correct it.
Absolutely. And that will then create bloating and food sensitivities too, because if you can't digest the food, there's stuff left for the immune system to tag as your non-self, and then you have antibodies to foods that should be good for you. I just had somebody in today, things like almond and tomato and ginger, these things that we think are good or superfoods showed up as a food sensitivity because we have gut
So where do you
dysfunction.
start kind of untangling this web of kind of cascading issues?
Yeah. Well, just asking the questions, what are your symptoms? So sometimes people will come in with migraine headaches, and they say it always starts in the front of my face. Well, that's not usually what a migraine is. It's usually behind one eye. So I'm looking for sinus congestion problems, sinus irritability. I can look right at somebody's face and see whether or not they have rosacea, and that's another indication, because again, the acid is getting up into the sinuses, which are connected to the blood supply with the face. So if you get vasodilation from that irritation in the sinuses, it's going to show up on the face. So just little things like that, or constant clearing the throat, hoarse voice, etc. So once that's established, then we can start looking at the gut. Sometimes we just treat it with digestive support, stuff that heals the gut lining. When I say digestive support, things like apple cider vinegar, hydrochloric acid, digestive enzymes. I generally won't give people acid if they're already hurting. It's like, lemon juice on intact skin does not hurt, but if it's irritated or if you have rose rash, it's going to hurt. Take a look at the diet. We'll remove irritants at first. Things like alcohol, caffeine, spicy stuff. Those things just hurt. But then there's things that you get an immune reaction to. So if we need to, we'll do food sensitivity testing. And everybody's different on that. And there's nothing inherent about any given food of why it becomes an allergy for somebody.
So you're basically kind of taking them through your system and process that you've developed as you kind of eliminate various kind of constituent pieces. Hopefully look to see, is there symptomatic, is there relief? Are we looking at those underlying causes that start to clear up? And if not, continue down until you.
Exactly. Yeah. And we'll also clear out the head too. So a lot of people with reflux, they'll sit up, sleep propped up just to keep the acid from going up. So we know that this happens. We know this. But how do you get rid of that? Because it's sitting there all day long. So we'll wash it out. Sometimes it affects people's eyes. So we'll wash it out of their eyes, and then they're clear for the whole day, and then they'll get on with their day. And there's a chance then for those tissues to heal throughout the day.
So that'd be something as simple as like a neti pot that you could use?
Neti pot, saline wash, yeah. any
Nice.
kind of device like that. So there's various formulas that we'll use depending on what the symptoms are.
Do you give them mineral supplementation too, like zinc or anything like that, or is there anything like specifically that you would use for the sinuses in that realm?
Yeah, we'll do immune support if they tend to get the infections with it, because we see that all the time. Any kind of, even a viral sinus infection, again, it will close, then the bacteria will grow, and that's why people have a sinus infection for a week or two, and then antibiotics will work. It's because the virus is gone, but the bacteria is there. So, so we'll do all sorts of stuff like that.
Now, kind of from left field, but I've heard rumors that oil pulling, coconut oil pulling, would help with sinus infections as well, and or like congestion overall in the sinuses.
Tell me more about that.
Well, I guess the theory is more so that the caprylic acid in the coconut is like through the teeth can actually access the sinuses and can clear out the bacteria and the microbials like that.
I didn't know it could do it through the teeth.
Yeah, that's the theory.
That's
I mean,
the
there's
theory?
no real, like, because I haven't seen any science about it either, but I've had many patients come in with sinus stuff and they swear by oil pulling. They say if they do it like weekly that it doesn't accrue in their sinuses and that they can breathe freely and things like
Cool.
that.
And oil pulling is? How do you do it?
Oh yeah, oil pulling. So like basically you take like a tablespoon of coconut oil, you put it on your tongue, let it melt down, and then basically you're just swishing it through your teeth. So you're just kind of, by doing that, you're also going to be killing any bacteria that's hanging around on the teeth. It helps your plaque, and like with any plaque buildup, it will. And some people have the train of thought that it can actually help your teeth absorb more nutrients as well. So it can help to kill cavities and things like that.
Sure, why not? It's dynamic tissue.
Right.
Yeah, I only
So-
know of caprylic acid as being antifungal, but sure.
Well, absolutely. It's antimicrobial in general.
In general.
So
Hey, we all learned
kills
something
bacteria
new.
as well. But yeah, I've used like oil pulling for my sinuses in the past, but like I've never noticed like the same results as like some people have told me. Like it's the only thing that helps them. Personally, like I'll do anything that helps move the sinuses and or the lymph and or congestion itself is usually what I try to target on my own self.
How often will you do that? Like go daily?
When you're talking about
oil
like oil pulling,
Yeah.
I was doing it at first to help with my teeth because I just my family tends to have pretty weak teeth. We tend to get cavities a lot, and I was trying to figure out like more natural means of cleaning your teeth rather than just using a bunch of fluoridated like toothpaste and things like that. So I was doing it like almost daily, and it was like you could notice like some benefits from it, and like you feel like cleaner in your mouth, so to speak, from that. But it's a habit that like is hard to like stay consistent with, I'd say, because I mean it's just really inconvenient. You're not going to swallow the oil like after you've washed out like the nasty stuff, and if you're spitting it down the drain, like if you don't have hot water running, like the coconut oil can solidify and
Yeah, there's going to be
cause
some
issues.
logistical issues with that. That's a tough one, for the daily.
So usually it would be like on the way, like walking to class or something like that.
Got
where
it.
I'm not really thinking about it too much.
Garbage. Throwing spit it outside.
Right.
Well, it would make sense if you're killing a lot of bacteria in the mouth and the immune system doesn't have to work as hard to drain the lymph from there, then there would be more resources to pull it from the sinuses. I don't know, I'm just thinking of some ways that it could work.
Right. I mean, that makes sense. It's not necessarily like helping you do anything specifically as much as it's just decreasing the stress in the area.
Yeah, which is what
Interesting,
we're always trying to do. Yeah.
Right.
I just
Open
think
up
this
those
is
pathways.
such a like we've have so many devices, like you were talking about the bed. We have so many devices to get away from acid reflux. This patient who this podcast is dedicated to, he also is like, I have acid reflux, or he had it in his past anyway, and so I think for people to understand, like, if you've had acid reflux, if you've got a full ear, if you've got, just to think about other things other than just, a sinus infection and or something else going on. So what would you say, like, if someone's experiencing this, what would you say would be their first go-to? Like they've got a full ear, they can't seem to clear it. Where would you have them start on their own, or would you have them directly come and get an assessment?
Well, depends on if it's new or if it's chronic.
Okay.
But the first thing I can think of is wash off that eustachian tube, gargle with salt water.
Okay.
Super
that's simple.
fast, super easy. If there is reflux and there's any kind of sinus drainage, which there almost invariably is, using a neti pot or doing some sort of nasal irrigation is a really, really important thing to do. Then dietary, cleaning up the diet, that's obvious. If somebody's eating processed food all the time, that's kind of a gimme. Anything that they know that gives them reflux, they should stop until you can get things fixed, because then you can get to a place where you can tolerate things that might be spicy or acidic or something like that. We're supposed to be able to tolerate that stuff. You think about things like ginger, cayenne, garlic, black pepper. These things are all anti-inflammatory inherently, but for some people they aren't because they've got inflammation going on that it then is an irritant. But again, avocado can be an irritant for somebody. Just depends on what's going on.
So digestive support early in as well.
Yeah.
Like, would you recommend the apple cider vinegar for everyone, or
Not for everybody. It
Yeah.
depends. If they feel the acid reflux, if it hurts, don't use an acid. You start with just the enzymes and then go from there.
Are we thinking like an elimination diet type deal? Are we gonna the classic elimination diet where you can pull out?
You can, but it's different for everybody. You know, the classic one you would be talking about would be like wheat, dairy, eggs, soy, sugar, and what are some of the other corn? I rarely see sugar, corn, and soy come up on a test. The other ones all the time, but it's like and even then, not everybody has that mix, so you don't know. And when I test, it's 150 foods and change. So we're learning what you can safely eat and what you can't at the same time. So
yeah, and I will say from my own experience, there's a lot of science to healing the gut.
Yeah.
So I think if people are triggered with a gut issue, then I think they need to probably seek some assistance.
I think you need some guidance. I think the gut issues can be so complex. I had a friend with like a SIBO type condition that spiraled into all these other things, and she went through a host of kind of traditional approaches to what was happening with zero relief and all kinds of medications, and it wasn't until she got more into a naturopathic functional kind of integrative doc that started to really say, hey, I think you have SIBO, and start to treat that. And it's complex.
Yeah. So SIBO is you need a whole nother podcast for that one.
Podcast for
but
SIBO.
just briefly, SIBO is small intestinal bacterial overgrowth. So the question is, first of all, where does that come from, and why is there an overgrowth? So bacteria are supposed to live in the large intestine, in the colon, and when it gets into the small intestine, they're working their way up. So that means that there's something that suppresses it in the small intestine, and if that function isn't occurring, they're going to start working their way up. And what the symptom is usually bloating and pain, because those bacteria are fermenting all of the food instead of just the undigestible stuff. And the products that they're throwing off, like histamine and other fermentable products, cause a lot of pain. And for some people, it's all the way up the gut. Sometimes it's just not all the way down. And that means there's a liver problem. So again, it's its whole own topic. And the treatment for it is typically a topical that's swallowed, but it's an antibiotic that works on just the mucosa of the gut. And with luck, it works for up to 6 months, but it costs thousands of dollars, and insurance almost never covers it. It's really, really difficult. Yeah, rifaximin or Xifaxan. And then people are told to eat a low FODMAPs diet, which is these fructooligosaccharides, like small fibers. And it's a hard diet to do, and it doesn't fix the problem. It only provides relief, because those bacteria can't really metabolize it. So it's difficult, but very, it's difficult. But when we get somebody who responds well, they just feel so great.
Life changing to get rid of it.
It is life-changing.
Avoid it in the first place if possible. And not something. A lot of the stuff with the gut issues is like you don't think about it until it's too late, and you have this problem that then it's been compounded because you've gone down this number of paths that seem to be the right paths to take, and you've taken some variety of medications and other things, and unintentionally the problem has gotten worse, and now you're in a spot really where you need somebody who can specialize.
Yeah, it's hard to see the forest for the trees when you're inundated with too much information and don't know what the prioritization is. So.
Especially these days. Yeah, especially these days when you can jump online and, self-diagnose everything. Well, this was cool. So, Dr. Becky, if somebody has this issue and they're listening to this, you gave some great tips and some great advice. And if they're local, this is something that you can help with.
Yes, Seattle Naturopathic Clinic.
Okay, awesome. Yeah. And where is that?
It's in Edmonds.
Okay.
Not too far from here at head to toe.
Awesome. Yeah. Well, thank you for coming on the show, and thanks for sharing. And I think for people who have this issue, it's really a great message of hope. I mean, we can fix it. It's fixable.
Can fix it.
Absolutely.
Oh, yeah. Awesome.
Huge.
All right. Well, guys, until next time, as we know, movement is the best medicine, but sometimes you need an expert to come in and help with some other medicine as well.
Clear the ears.
Thanks, guys. We'll talk soon. Bye.
Thanks, Barry.